When you look in the mirror, what are you seeing, and why are you noticing that now that it's at actually a point where you want to treat it?
I guess what I'm noticing most is this area and my smile lines in here. These across my forehead, and then just I noticed in looking at older pictures, this has deepened. I always had a pretty pronounced fold here, but it's gotten deeper, and then further in down below my mouth, those marionette lines.
But we were talking earlier, and you said you really do like to have the character lines. You wouldn't want to lose.
I don't want it to be all flat.
Right. And that's oftentimes a common misconception of Botox. And yes, and you see maybe those TV anchors where they have that real blank look. I don't think any of us really want to have that because we lose our expression. And you're the type of person very happy and cheerful, and you have those nice smile lines. And that I think
if I don't have nice smile lines, I don't know what I'm going to do.
Well, we don't want to get Frown.
We don't want to lose them all together.
But what we do want to do is to kind of soften things and kind of provide a refreshing look. And so what we're going to do is just reduce the lines. If we look over here, so we're going to reduce the frontalis lines. And if you frown, this is what we call the glabellar lines. And this is caused by these muscles that are going to contract the eyes down. The periorbital muscle is going to create that opening effect and also this squinting. One of a prescription or formula to doing it. And for the glabellar region, we're going to be doing essentially 20 to 25 units. Maybe a frown, please. And we're going to work on these muscles that are causing this indentation and furrowing effect. And so we usually will do about 5, almost like a little butterfly effect. And we also like to do a little bit right on the nose right there to get rid of the bunch right there. We're going to do about 5 units. Good job. I'm going to go just right in here. We're going to make the marks. I'm not really going in that spot because I don't want to drive in that liner. But it gives me an idea where I would like to be. Okay. So how was that? Okay, so that's really going to take care of these retractive muscles that cause that frowning appearance. So now what we're going to do is go to the frontalis muscle, and we're just going to put in a few drops, a few units on to make it smooth out. So where do we want the muscles to still pull? Is on that lateral third of the eye, so we get that little bit of an eye lift or brow lift effect. Now I'm using a 1 unit, I'm doing 1-to-1. A lot of docs will do a 2.5 to 1, and so there's a lot more injection, a lot more fluid that's placed into the skin. We really don't like that. It's not necessary in these. We have just such a small, little, thin muscle such as the frontalis. We don't need to put a big bulk in where it distributes itself over a period of time and potentially can actually, if we're close to the eye, go into the eye. So we don't want to do that. Now, one of the other concerns and complaints was around the eyes. So what we're going to do at this point is focus on these lines that radiate from the periorbital region. And why do we get this? A couple of reasons. Laughing and carrying on and having a great personality and just enjoying life. But we can also get from squinting. And of course, over the decades, we start to develop, gravity starts to have its effect on us. And intrinsically, we're losing the collagen structures, that type 1 collagen, which provides that foundational support starts to go away. So let's go ahead and relax some of these muscles, which after about 5 days, you're going to notice that this becomes much brighter. Patients come back, I think that's the area that they're most excited about to get this muscle. Not going very far. I'm going to put a couple units in each spot. They're going to put a little pinch right in those areas. Get a big smile again. Go so much as to go in just a little bit up here.